don't forget to click the subscribe button
and the notification bell
to see more of the Contessa's videos.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have another special topic, the so-called brow lifting using our PDO threads. And today with us, we have a special guest, a Korean pretty one. Let's all welcome Miss Helen Kim. Welcome, Helen.
Thank you for inviting me.
Wow. So Helen, how do you like the Philippines?
I love this country, of course.
It's beautiful.
Yeah, beautiful.
And
Not cold.
not cold, just the right temperature, the right weather.
Yes.
Right. And Helen here is still young. May we ask your age, if you allow us to know your age?
Yeah, just turned 44.
Wow. Belated happy birthday, by the way.
Thank you.
So Helen here, she's 44, but I think she looks a lot younger. Because people could think like you're in your like 30s, early 30s, okay? Because if you look at the face, okay, the aging signs of the face, and Helen is aware of that, right? Especially the Koreans are into beautification, and they know all these treatments, the P-contour, right? You've started a lot of different kinds of aesthetic procedures. In your country, you have a lot of procedures for beautification and rejuvenation. Now, if we do aesthetic assessment, okay, what we do is we divide the face in three divisions: upper third, middle third, lower third. Now, looking at the upper third, okay, because our topic today is brow lifting using our PDO threads. Okay, on the upper third, what do we check? We check for lines, wrinkles, or we also check for volume loss, okay, and we also check the position of the eyebrow, okay, because the upper third is from the hairline to the eyebrow section, okay. Helen, is there anything that bothers you on your upper third of your face?
Let's start a little bit sagging, I feel.
Sagginess, okay? So the so-called ptosis, or like the brow beginning, brow sagginess, as well as the upper eyelid.
Yes.
But of course, the Koreans, your eyes are really shaped like that,
Yes.
right? You have like really a lower upper eyelid, okay? Or they say like the epicanthal fold, something like that. And that's why in your country, a lot of Koreans doing blepharoplasty, right? The surgery, right? And with Helen, we're seeing some beginning or the so-called dynamic wrinkles, the dynamic lines, and also some static lines there. So what we're gonna do today is to improve, okay, her concern, the sagginess. We wanted to do a lifting. So we'll be doing a non-surgical procedure, the so-called brow lifting using the PDO threads. We'll show you the actual demo or the demonstration of the procedure when CSA Medical Aesthetics return. Back mga ka-CSA, so we're doing the forehead region or the upper third of the face. So we've mentioned a while ago that the upper third is from the hairline here up to the eyebrow region here, okay? So when we do the forehead, the section of the forehead, we have the superior orbital rim here, and then you palpate for the temporal crest or temporal fusion line. So you follow that line here. So that is to delineate your forehead section here. So separating it from your temple, okay? So we are on the forehead area, okay? So our goal is to do a lifting for our saggy brow here, or even the saggy upper eyelid. Now, in doing a procedure like this, of course, doctors are anatomists. We have to remember our the vital structures in this section here. We palpate for the supraorbital foramen here. Okay, here it is. So we know that in your supraorbital foramen, you have your supraorbital blood vessels and nerves. Okay, so you have structures here that come out, and then medial to it, like about 1 cm to it, is your supratrochlear blood vessels and nerve. Okay, so same thing on the other side. So for our doctors, take note of this important structure that you really have to avoid, especially when we're doing like filler injections. Okay, the good thing we're doing the thread lift, right, Helen? So, but in doing our any injections for our forehead, you still have to delineate that those important structures. So supraorbital foramen here, and you have your structures here, and medial to that your supratrochlear. Okay. So we don't want to injure those blood vessels. So we wanted to do a lifting. Okay, so in the center section of our forehead, we can do lifting there. And if your patient has this we call 11 lines or frown lines there, we can also correct that. So what I do is I have an entry point here, the superior part, and ruler please. We can make your pattern for your thread here, like an inverted V here. Or for some of my cases, I also insert another PDO thread there. Okay, so this is for the central lifting here. Now for the lateral aspect of our eyebrow, particularly the arch, if you want to do a lifting of this arch, some women would want to have a high arched eyebrow. So entry point here again near the hairline, and then if you want to lift the arch there, you can do this. And some of our patients will still want to lift this part here, you can also do that. So basically this is the pattern that we will follow when we do our brow lifting using our PDO thread. So take note that we're trying to avoid those important structures there. So we have our arch here, lift that. Okay, so this is the thread lifting for the forehead. Okay, we had previous episodes where we did some fox eye lift. That's more of the tail of the eyebrow. Okay, so for now this is our technique for the forehead brow thread lifting. So we did cleansing of the area, disinfect it, and then we also had the topical numbing cream, and then I'll still inject my lidocaine onto the entry point here, okay, the hairline here. Okay, for some cases I also inject the entire tract of the thread, and then I'm just gonna also numb the brow area here because this is somehow sensitive too. So okay, there you go, just a little bit, and then we'll make an entry point, gauge 19.
Yes.
Yeah. Then your sterile OS please. So just a tiny prick there, and then I'm using my spiral cog 60mm with a PDO loaded in the cannula already. So initially vertical approach, and then glide towards the arch of the brow. Okay, just glide, there you go, there, up to the arch of the brow. Okay, and then hold on that and pull out. There you go. And then a second one, same entry point, and then glide towards the tail of the brow. You can do your tail brow lifting. Okay, glide towards that. So it's a deep plane and pull out. And last one here for this side, glide. So we're using 3 spiral cog 60mm for this side here, and then pull out. Okay, so now we can cut the remaining strands. There you go, done. So we're now proceeding to the central section of our forehead. So we have to numb the entry point, and we're using our lidocaine with epi, and then after numbing that, we'll be starting with the PDO cog thread. So it's normal that our patients will feel some discomfort with the injection of our lidocaine, okay, because this one is like, there's a sensation of like it's stinging, or it's like a burning sensation for me actually. But once they're numb, once it's already injected with the lidocaine, then the patient will not really feel the entry of our threads. So we're using a gauge 19 type of needle to puncture the entry point. Okay, the goal is to insert the entire cannula in a deep anatomical plane. Okay, so it's 60 millimeter PDO spiral cog thread loaded in our cannula and just glide towards the center. So the goal of this one is to lift the medial brow or the medial section of our forehead. Especially this type of procedure is good for those patients who don't want to do toxin injections anymore, because the toxins can further weaken the frontalis muscles, and we need our frontalis muscles to lift our eyebrow. And when we inject with toxin, they further have weakening of the frontalis muscle. Once they're weakened, then they cannot lift their eyebrow. So this is so good for those individuals who doesn't want to really go through toxin injections anymore, especially those who don't want to do filler injections or your hyaluronic dermal filler. So this is making use of our PDO threads, and the PDO threads are like protein strands. So when you say protein, they're fibrous materials, and they help in stimulating collagen synthesis, as well as, of course, improvement of the skin texture, regenerate those tissue matrix. And these are already the so-called regenerative products, and it's non-surgical, and it's a quick procedure and minimal downtime only. So we have done our forehead brow thread lifting, so we'll show the result to Helen when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So we have done the forehead brow thread lifting for Helen here. We have added Fax Eye treatment too, and also the mid-cheek volumizing thread treatment. And so Helen, here's the mirror.
Yeah.
There you go. Check on your face now. What do you see? Puncture marks, of course.
Yeah, of course I can see the puncture mark.
Yeah.
But yeah, I feel like a bit younger.
Been younger.
So after
Yeah.
2-3 years, I'm gonna be still okay.
Yes, exactly. Like, because you know that threads still take, they still have an effect inside your tissues, right?
Yes.
So it takes time to further improve.
Excited to see after 2 to 3 months.
Yeah.
Effect more effective.
Yeah. Actually, Helen, it's not her first time to do thread lifting. She had an experience of the threads already, and she had a wonderful experience about it. Anything that you would want to share with our televiewers?
Yeah. Actually, I love thread lifting because it's so natural. And then after procedure, naturally people keep saying why you don't age. So of course, all the women like to listening that comment. So I want to be continue and then not getting aged.
Exactly.
Very naturally.
Oh, that's why Koreans, they
Yeah, of
look
course.
they look so young.
Yeah, of course. No pain, no gain. Also no pain, no gain.
Yeah. And the wonderful thing with the threads, they also have an improvement on the skin, on the surface, right?
Yes, yes.
You notice, like, aside from the lifting effect, because there's collagen stimulation, like your skin texture is improving.
Skin
right?
texture also improving, and then also color. It's like a
Oh,
brightening
yeah.
also.
Yeah,
Yes.
yeah.
I like that part.
Yeah, I remember there's a Korean doctor sharing with me that these threads also have this lightening effect.
Yeah, it's not really
Not really
whitening,
white,
but
yeah.
the skin tone is much.
Skin tone, there
it's
you
very
go.
good. Yes.
See, we're learning from our Korean guests. Actually, it's our first time to have a actual Korean, a real Korean. Okay, because we had guests before. They look like Koreans, but they're not Koreans.
Yes, I'm
Okay,
Korean. but
so thank you so much for being with us, Helen. Hope to see you again in our future episodes.
Sure, always.
Oh, can they reach you, like, if they have a question? Because some of our televiewers would want to ask questions to our guests. If they, like, want to ask, like, how long did it last? Was it painful? That's what they're always asking me.
Yeah, it's a bit painful, especially when they inject the anesthesia. Of course,
Oh,
they're
yeah,
a bit
there's
painful.
a discomfort
and then,
there, yes.
discomfort feeling.
Yeah.
But kind of tolerable. Yes. Yeah.
Do you have any, like, a social media account? Instagram?
I have a Facebook.
Oh,
Yeah.
yeah.
I have a Facebook, so can ask me any
Helen Kim.
question. Yes.
Just Helen Kim, and just ask her about this procedure, okay? Don't ask her any personal questions. Okay, thank you so much, Helen.
Thank you.
Okay, for all of you, those who have questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the CSA Medical Aesthetics Infinity Shop, Pulong Maragol, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. And also my FB, Contessa Salvador, and Helen's FB again, Helen Kim. Okay, so thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.